Hi, I'm Trudy with Heal Wellness and Therapy, and today I'm here with my friend discussing the hip. We are going to focus specifically today on the hip flexor called the Psoas, P-S-O-A-S. Now we have 4 hip flexors, but the hip flexor that is primarily related with hip pain and back pain is the one hip flexor muscle that attaches to both. The psoas muscle on my little anatomical model here, this is your lumbar spine, and this is your hip joint. The pelvis is in between. The psoas muscle attaches to the lumbar spine, comes through the pelvis, and attaches to the inner part of the hip. So oftentimes, particularly with people that do a lot of sitting, the psoas muscle tends to get tight, tense, and likely short. We're going to go over today activities and active elongation exercises to lengthen and relax the tension within that psoas muscle. We will begin with the hip flexors, specifically the psoas muscle. We have 4 hip flexors in the front of our hip, and we're going to focus on the one that attaches to the spine, the pelvis, and the hip, and most impacts the function of the spine and the hip. To self-evaluate your own psoas muscle, you need to elevate your pelvis off of the surface you're laying on. You can certainly use a standard pillow as long as it's firm enough that it doesn't compress to a point that you cannot elevate your pelvis. But what we're really going to use today for you to see tightness and tension in a psoas muscle is a yoga bolster. Specifically, yoga bolsters are nice to use because they elevate your pelvis 6 inches off of the floor. To self-evaluate your pelvis, this is what you do. Take both knees and bring them towards your chest. Hug them into your chest. Then take a nice deep inhale. As you exhale, pull both knees tightly to your chest. Hold the left knee with both hands. Take a deep inhale and straighten the right leg all the way out. As you exhale, pull the left knee back into your chest. Now, inhale, straightening the right leg. Exhaling, trying to pull the right leg downward towards the floor. Hold right there, my friend. In the efficient position, without any tension or tightness in the hip flexors. The leg should be parallel to the floor. So if her hip flexors were not tense and shortened and tight, we would see a position that she could get to that is there. However, for that to happen on her, she has to create a lot of motion in her back, which is why this particular hip flexor affects the hip and the back so much. So let's go over a very nice active elongation exercise to perform to lengthen your own hip flexors. Keeping the left knee to the chest, take one deep inhale, exhale, pulling that knee nice and tight to your chest. Now with the right leg, exhale as you kick that leg far away from you, keeping the knee straight, and then bringing the leg down. Back to the left leg, take a deep inhale, and then as you exhale, firmly snug that knee into the chest, taking away from any motion in the low back. Now taking the motion to the right leg, inhale, straightening the leg, exhaling, squeezing with the gluteal muscles and pulling the leg down to get a beautiful stretch through the front of the hip muscle. Taking a deep inhale, exhaling, squeezing the glutes, keeping the knee straight and lengthening. We're going to do this for 3 more breaths. Nice deep inhale and exhale, elongate. 2 more breaths, deep inhale in and exhale. And deep inhale in and exhale. Slowly bringing the right knee back into the chest. On an inhale, exhale, hugging the knees to the chest, switching to now doing the opposite leg. So taking a deep inhale, exhaling, pulling the right knee into the chest. Inhaling, straightening the left leg all the way straight first. Exhaling, bringing it down. Again, seeing a tight hip flexor. It is not parallel to the floor. Now, deep inhale. Exhale, pulling the right knee to the chest and keeping it there. Now the focus to the left leg as you take a deep inhale. Exhale, squeezing the glutes and lengthening as you try to actively bring the leg towards the floor. Keep going for 3 deep inhales and exhales. How long do you hold this elongation? Well, research is variable. We know that we want to hold any sort of elongation of a muscle for a minimum of 15 seconds, but we also know that breathing really helps us to relax a muscle. So I encourage you to hold your active elongation for 3 to 5 breaths. One more deep inhale, tightening the leg. And exhaling, squeezing the glutes, feeling the stretch into the hip region. Then gently inhaling, bringing the left knee back in. And then exhaling, pulling those knees to the chest to stretch out that low back area. Very good. Okay. And now a second way to work on that hip flexor called the Soaz. So what you want to do is begin in hands and knees position where your hips are hip distance apart. So if you are in hands and knees and you take your 2 fists and you bring them between your knees, that is going to be hands and knee hip distance. Starting in this position, we're going to stretch the right hip first. So taking the left leg, bringing the foot all the way to where her left hand is. And then in that position, making sure that this right hip doesn't fall forward. That is the mistake that happens with most individuals who try to get to this hip flexor but aren't successful. Then taking her hands up to her thigh, she will then keep her hands on her thigh and allow her rib cage to stay forward so that she doesn't go into what is typically called a runner stretch, which is pretty much just a backward bend. So what is often done for hip flexor stretching is the person comes all the way upright, thrusts their pelvis forward and leans forward, and there is absolutely no lengthening or relaxation of that psoas muscle. So let's talk about a better way to do it. So in what we call half kneeling, stacking the knee directly underneath the hip, taking the hands, placing them on the opposite thigh, and then weight bearing the rib cage forward onto the opposite thigh. Then in that position, allowing a contraction of the gluteals and the abdominals to tuck the tailbone under will create the stretch in the hip that you so desire. If the hip falls forward of the knee, oftentimes the individual will lose that contraction and lose the ability to lengthen that muscle. So in that nice hard tilt, pelvis neutral, rib cage forward, begin to take a deep inhale. And then as you exhale, tucking a little bit more, keeping the rib cage forward. Very nice. 2 more breaths, please. Deep inhale and exhale. And as she starts to get some length, you can begin to play with pushing the pelvis slightly forward, but only if you don't lose any of the tuck of that tailbone. 1 more deep inhale in and exhale. Doing the opposite side, bringing the left knee back down, going to hands and knees. And then we're just going to turn around so you can see the actual stretch of her left knee. So as she turns to go to the left knee, stacking the knees underneath the hips, having them hip distance, bringing the hands forward, finding tabletop position so that the hip is directly on top of the knee, lengthening through the neck, allowing the chin to gently tuck inward, tabletop position. Now, taking the right leg, bringing it up towards the right hand for half kneeling. Once she finds half kneeling, making sure that the hip is stacked vertical on the knee, then taking the hands up onto the right thigh, bringing the rib cage up, but not allowing yourself to backward bend. So keeping the rib cage forward, keeping weight onto the hands. making sure that the hip stays perfectly stacked on top of the knee. Tucking the tailbone under until you feel a stretch in the front of the hip. In that position, deep inhale in. As she exhales, tucking the tailbone, finding more length, more relaxation through that hip flexor called the psoas. Deep inhale. Exhale. Beautiful. Lots of relaxation that time. Nice deep inhale and exhale. Let's do one more breath with a little bit of a reach forward right there. Deep inhale in and exhale. Slowly coming out of it, bringing her right knee back down, going into tabletop position. So we've discussed the psoas muscle. I've shown you 2 exercises to create more length into the muscle and relaxation through the pelvis, the hip, and the low back. I'd like to end by asking my friend if she has any questions relative to work on the psoas.
I just have one question about daily activities. Is it best to continue to walk? Is it okay to cycle? Is it how much sitting? Should I monitor my sitting versus standing during the day?
It's a great question. What I will tell you is that the key activity that creates increased tension and shortness in the psoas muscle is, of course, sitting. And so what you want to make sure is that you have the regular habit and the self-care habit of walking. Cycling is a great exercise for cardiovascular endurance and balance. However, it does tend to tighten and shorten the hip flexors. So the key activity I would encourage you to do as often as you can, hopefully daily, is some amount of walking to create the length through the hip, the back, and the pelvis area. And I would end with saying that should be done on a daily basis. Now, to conclude, on the bottom of this video, there's a button here that you can like our video. Please do that. Also, subscribe to my channel. If you have any questions, feel free to place those into the comment section. And that little bell that's somewhere over here, if you select that, you will be notified the next time we put a video together. Thank you for joining me with Heal Wellness and Therapy. What's called your psoas, P-S-O-A-S. The psoas muscle, his spine dislocated. I'm gonna keep going just so you can see what I'm talking about. The one that we are gonna focus on today is the psoas muscle, like I previously, start it again. Muckle? What's a muckle? 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 And what's a muckle? Oh my God. We are using a bolster, okay. Deep inhale and exhale. There's a fly in my mouth. No. Oh my God.